Okay, hold up. Let's talk about this because I'm tired of seeing this kind of language and discussion around HIV and AIDS. First, I want to start off with defining the terms. HIV is human immunodeficiency virus, and AIDS is acquired immunodeficiency syndrome. The language we use matters because it can either empower people and reduce stigma or perpetuate the same harm that people living with HIV have been faced with since the beginning of the epidemic. Some people do not care at all about trying to be conscious about their language because of their stigma about HIV and misconceptions, but there are some people who have good intentions and are not trying to be hurtful. If you have good intentions, there's a guide assembled from multiple HIV and AIDS organizations with the preferred language for terms related to HIV and AIDS. First, let's start with this. Terms such as HIV infected person, HIV AIDS patient, HIV AIDS carrier are stigmatizing. The preferred terms are person or people living with HIV. Person first language that prioritizes the person, not their health status, is important because otherwise that can be dehumanizing. People living with HIV established this in 1983 with the Denver Principles. With their statement, "We condemn attempts to label us as victims," a term which implies defeat, and "we are only occasionally patient," a term which implies passivity, helplessness, and dependence upon the care of others. We are people with AIDS. Next, another phrase that reinforces stigma is died of AIDS or to die of AIDS. It's preferred to use died of AIDS-related illness or AIDS-related complications, or even died from end-of-stage HIV. This is because AIDS is not a disease. As UNESCO explains, it is a syndrome or a group of illnesses that result from a weakening of the immune system. People die from opportunistic infections or illnesses that are more likely to occur when you have a badly damaged immune system, like from HIV, such as tuberculosis or bronchitis. The last term I want to mention isn't exclusive to HIV, but still relevant. How about we just drop the use of the term clean when referring to HIV or STI status because it falsely suggests that people who are living with HIV or contract the STI are dirty. Let's not do that anymore. That's just dead it. Like the eye roll whenever I see someone calling people with STIs or HIV dirty. Anyone can acquire an STI or HIV. You are not clean because you don't have one. I learned a lot while reading these guides, and I suggest you do too. We can all do a little work to ensure we're using language that doesn't alienate people living with HIV, but is respectful and accurate. Let's all work to reduce stigma around HIV.